Some diseases don't shout, they whisper. And those whispers often start where most men never look closely their own body. As a urologist, I've seen countless men come to my clinic thinking it's just a small infection, a little irritation, maybe stress. But what they don't realize is sometimes those small signs are signals from something much deeper. HIV doesn't always begin with fever or weight loss. Sometimes it starts with subtle changes, the kind you notice but ignore. And before we begin, let me take 1 second to say we are just a few subscribers away from 1,000. If you believe in real, science-based health awareness, not fear or myths, hit that subscribe button right now. It helps us reach more people and save more lives. When HIV enters the body, usually through unprotected sex, contaminated needles, or infected blood, it doesn't attack muscles or bones. It targets your immune system. Specifically, it goes after a key type of white blood cell, called the CD4 T cell, the commander of your body's defense army. Once the virus enters, it hides inside these cells, rewrites their genetic code, and uses them to make more copies of itself. Over time, these CD4 cells die off. Your body slowly loses the ability to fight infections. But here's the critical part. This process is silent at first. The virus may already be active, but symptoms are minimal, maybe fatigue, maybe some skin issues, maybe nothing noticeable. And because the genital region is rich in immune cells and mucous membranes, early changes often appear there first. Men just don't connect them with HIV. The first sign many men ignore is burning or discomfort while urinating, what most assume is a urinary tract infection. But here's the red flag. If it doesn't respond to antibiotics, if it keeps coming back, or if it comes and goes randomly, it might not be a bacterial infection at all. In HIV, the immune system's local defenses weaken, making the urethra inflamed and vulnerable. You may not have visible discharge, but you'll feel a lingering irritation, especially in the morning or after intercourse. I've had patients who went through multiple antibiotic courses with no relief, only to later discover HIV was behind their chronic inflammation. If you've had unexplained urinary discomfort that refuses to settle, don't keep guessing. Get tested. The second sign, one that men often misjudge, is sores, ulcers, or dry rashes on the penis. They might appear as small red bumps, painless blisters, or flaky skin patches. Some fade in a few days, others return again and again. Because early HIV weakens your skin's healing ability, even minor irritations can take longer to recover. You might think it's just a fungal infection, maybe from sweating or tight clothing, but in reality, it could be your immune system showing the first signs of struggle. Sometimes, these sores come from other viral infections, herpes or HPV, that HIV makes easier to catch. The connection is indirect but critical. When your immunity dips, your skin becomes the first place to show distress. Doctor's tip: any genital sore that doesn't heal in 2 weeks or keeps recurring should be checked beyond surface level. Don't self-medicate with creams. Test and confirm. Your lymph nodes are like the filters of your immune system, and when they're active, they swell. The groin area has several such nodes, and in early HIV, they can become firm, rubbery, and noticeable, but not painful. Most men ignore this completely. They assume it's from friction, shaving, or muscle strain. But swollen lymph nodes lasting more than 2 weeks, especially if they're not tender, deserve attention. In my clinic, this is one of the most common hidden signs of early HIV. It's the body's way of saying, something foreign is inside, and I'm fighting it. You may not feel sick, but your immune system is already on high alert. If you notice any persistent lump or swelling in the groin that doesn't fade, it's time for blood work, not assumptions. This one surprises most men. HIV doesn't only affect your blood, it affects your reproductive organs too. Many patients report that their semen looks thinner, slightly yellowish, or has reduced volume. Some feel a dull ache or heaviness in one or both testicles, even without injury. Why does this happen? Because HIV-related inflammation can reach the seminal vesicles, prostate, and testes. The virus causes microscopic inflammation that disrupts normal function. It can also affect sperm motility and testosterone production, leading to subtle hormonal imbalances. These are not sexual performance issues. They're early biological warnings of immune disruption. If your semen quality changes consistently, or you feel unexplained scrotal heaviness, get a medical evaluation not just for infection, but for immunity as well. One of the most telling but ignored signs of HIV in men is recurring genital infections. You treat them once, they return. You use creams, they fade, and then reappear weeks later. Common patterns include white coating under the foreskin, yeast infection or thrush, repeated outbreaks of genital herpes, persistent itching or red spots that don't heal. Why does this happen? Because HIV gradually lowers the immune barrier. Your skin and mucous membranes can no longer control normal microbes, so even harmless bacteria become opportunistic. It's like your body's firewall is turning off, little by little. So if infections in your genital region keep cycling back despite treatment, consider it a serious signal. Let me share what we see in real clinical practice, without breaking confidentiality. Case 1. A 29-year-old man came in with what he thought was heat rash. We treated him twice for fungal infection. It kept returning. Finally, we did an HIV test, and it came back positive. His only symptom had been skin irritation and fatigue. Case 2. A 34-year-old with mild groin swelling and no pain. He'd been fine, otherwise no fever, no weight loss. His test revealed early HIV, caught only because we checked his lymph nodes. That's why urologists often become the first doctors to detect early HIV, because the first clues usually show up below the waist. The truth is simple. Symptoms can mislead you. Tests don't. Here's what every man should know in 2025. Fourth-generation antigen/antibody test detects infection after about 3 to 4 weeks. HIV RNA PCR test detects virus as early as 10 days after exposure. Free and confidential testing available in most clinics and labs worldwide. If you've ever had unprotected sex, a shared needle, or even a tattoo from an unverified source, testing is not overreacting. It's responsibility, because with early detection you can live a completely normal, healthy life. Let's talk about treatment, because this is where most people still carry fear from the past. Modern HIV treatment, known as antiretroviral therapy, ART, is nothing like it used to be. No painful injections, no endless pills. Most people take 1 tablet a day. Some even get a long-acting monthly injection. ART doesn't just control HIV, it brings the viral load down to undetectable. That means the virus is so suppressed that it can't be transmitted sexually, a principle known as U equals U. Undetectable equals untransmittable. When started early, ART restores normal immunity, preserves fertility, and prevents organ damage. In short, HIV is now a manageable condition, not a death sentence. But you can't treat what you don't detect. Gentlemen, HIV doesn't start with pain, it starts with silence. It hides behind everyday symptoms: a small sore, a bit of fatigue, an unexplained rash. If something feels unusual, don't explain it away. Don't wait for it to worsen. Be responsible enough to get tested, not just for yourself, but for your partner and your future. And if this video taught you even one new thing, please support this mission. We're only a few subscribers away from reaching 1,000, and every click helps spread real awareness, not fear. This is Dr. Robert, and remember, early awareness saves lives.